Hello again, everyone, and welcome back to Reddit Aliens. I'm John, and as always, thank you so much for being here. A good topic? Let's do it. What seems to be a totally harmless symptom that requires immediate medical attention? Please remember to like, share, and subscribe. Superficial burns to the face typically result from barbecue or stove lighting accidents. It may seem like just a singed eyebrow, but if you were inhaling at all when the accident happened, you could have burned the inside of your throat. Most people present with normal breathing, but as the injured tissue swells, it can close the airway. Most of these people feel fine directly following the accident and end up intubated if they make it to the hospital. I got a small cut, little more than a scratch, on my arm cleaning under a conveyor at work, the sort of thing one barely notices. It was black with coal dust, so I rinsed it off. I didn't give it a good soap and water scrub until I got home several hours later. A few days later, I had a dark red bump with what looked like a pimple on it, where the scratch had been. I figured it could be an infection, but there was no pain or discomfort, so I figured it would heal. After a few days of it remaining the same, it suddenly grew larger and nastier looking. Still no pain or discomfort. I figured I needed antibiotics, so I made an appointment with my doctor. It was going to be a few days when, talking to my mom, who was a nurse, on the phone, she said it's serious, and if I can't see the doctor that same day, then I need to go to urgent care. I went to urgent care, and the nurse practitioner didn't seem too worried. Then I rolled my sleeve all the way up, and they saw the red streaks going from the infected area up toward my armpit. I was very surprised by what happened next, since I imagine people in urgent care see all sorts of bad stuff. They freaked out, saying I needed to go to the emergency room immediately. They asked if I felt okay and could drive myself. When I said yes, they said they'd call the hospital and give them my info and let them know I'm coming. They said I may have to stay for a couple of days on IV antibiotics because I had sepsis, an infection spreading through my bloodstream. I had to get lots of medicine, but only stayed in the hospital for one day. Apparently it was so serious because once the infection passes a certain threshold, people go from feeling fine like I did to deathly ill in minutes. Make sure to clean any cuts well right away. Hit your head hard? Get it checked out. I had a friend who fell out of a chair at work party and hit their head hard on the ground. They shook it off, started complaining about vision problems over the next several weeks. Their work performance suffered. Then between work and their wife, the people around them pieced together that they could no longer read at the same level. It wasn't their vision, it was their comprehension. They couldn't even perceive what was actually wrong. Long story short, it was a serious TBI. They had to go on disability and into rehabilitation therapy for over a year. Before I was admitted to the ICU for 2 weeks, I had muscle tetany. Felt like pins and needles in my feet, arms, chest, and weirdly enough, what felt like my nose for weeks. I thought it was just poor circulation, and it turns out I had undetectable potassium and phosphate levels, which did bad damage to my liver and kidneys. I went months without going to the ER because I thought I was being dramatic. Literally never write things off as something else. It's always better to look crazy than be dead. Also, for those that are biologically female, losing your period or prolonged amenorrhea is oftentimes a sign of something larger going on that's attributed by doctors to stress. Always get it checked. Strong feelings of impending doom if you don't have extreme anxiety troubles, especially if you just aren't feeling well physically. Years ago I had this, and 3 separate doctors over the period of a month completely failed to catch the textbook symptoms of a DVT. I felt worse and worse as the days went by, yet another doctor visit and my blood pressure was dangerously high. I couldn't walk more than a minute without being completely out of breath. All day I had strong feelings like I was about to die. I took myself to the ER and I actually was totally right. The missed DVT had resulted in a very bad pulmonary embolism in both lungs. My heart was working so hard that I nearly had a heart attack. I was in the hospital for around a week, and it took months to get back to my baseline. Pain in one breast after lying on it and or feeling a lump in my breast as a man. Breast cancer can and does happen to men. What's worse, doctors can be dismissive about it. Do not give up until it's checked through ultrasonography, even if you have to get a second or third opinion. A constant runny nose, especially if it's clear, watery, and coming from only one nostril, especially if it gets worse when you strain or stand, improves when you lie down, is kind of salty, metallic tasting, or is accompanied by new headaches, neck pain, or light sensitivity. That's your cerebrospinal fluid. That shouldn't be on the outside of your body. I had an infection in my toe, ingrown nail, when I was 16 or so, and they gave me antibiotics. The next day in school, I developed a fever of 104. My leg went numb and the skin on my leg was discolored and hot. The antibiotics they gave me weren't working for some reason. The infection went up my leg and I developed cellulitis. They gave me different antibiotics and those worked. But at the urgent care, they told me if we had waited any longer to go in, I could have needed IV antibiotics. If you have an infection and start developing new or worsening symptoms, despite being on antibiotics, talk to your doctor or go to urgent care ASAP. Well, I'll tell you mine. 2016, maybe 2017, I was working at a gym and we had boxing gloves and a couple of heavy bags. I was just doing some mitt work one day, and like 2 days later, I had looked like I had an ingrown hair on like my knuckle, right? Like a little red dot, whatever. Work, live, eat, keep going. It didn't go away. A little white head on it wouldn't go away. And then I was like, if I pop it, I don't know. It got bigger and bigger. Basically, it took up the whole size of my knuckle. And still, I'm just like, whatever. Then finally, it popped. I was working. It was at night, and the thing was like bad. I went to the VA hospital, and I'm like, hey, my finger's got this. And they were like, this is serious. And they put me on an extremely powerful antibiotic for like 10 days. Like, if it doesn't change, like you have to go to the ER immediately. Luckily, everything was okay, but it's things you don't think about. But yeah, be careful out there. If you have sciatica, the pain is down one leg. If the pain switches to the other side or goes down both sides, you need to get to the ER. It's a sign of cauda equina and signals irreversible spinal cord damage, can cause paralysis. Having a fever coupled with a high heart rate, those are symptoms of a type 2 heart attack. A friend and I were gaming one night when one of our buddies, male 30, mentioned that he was getting a fever. An hour or so later, he noticed that his heart rate was over 120 and his fever was at 104. While I would have popped a paracetamol and called it a night, our nurse buddy on the call said he should head to the ER immediately, and he said a higher HR is a sign your body is fighting something, but an HR that high is worrying. He got there and it turned out our friend had a type 2 heart attack. So a type of heart attack not caused by a blockage, but more from lack of oxygen due to the high heart rate, as our friend explained, if I remember correctly. He may have saved his life, as our friend would have just brushed it off as a weekend cold or something. He was a bit predisposed due to some excessive weight and love for drinking, but he's turned his life around and is doing pretty great now. Had pain in shoulders and back and what felt like indigestion, felt jaw pain, then fainted and was out for about 3 minutes. I broke my glasses, which caused cuts above my left eye. I'm a female over 60 years old, so I wondered if I was having a heart attack, but dismissed that and only went to the ER as I fainted. That was something that had never happened to me. Took an Uber to the ER. Blood pressure during triage was life-threateningly low. Not a heart attack. It was severe pancreatitis causing my blood pressure to tank. Apparently, there was a gallstone blocking the duct near the pancreas, causing acute pancreatitis. After 3 days in the MICU, where I was given drugs and fluids to raise my blood pressure, they moved me to a regular room. I then had surgery to remove my gallbladder and was discharged the next evening. I had no symptoms that are common for pancreatitis or gallbladder issues. Doctors stated my blood pressure, if they had not treated me quickly, was incompatible with life. Healing up and going back to work soon, just the weirdest random thing. If you hit your head hard, go to the hospital. If you fell, if you knocked your head against something pretty hard, If you got your shit rocked in a fight, if you got hit hard while playing sports, etc., it doesn't matter. If you think it wasn't that bad or you're getting up and walking around, you should go to the hospital. It's one of those cases where it's truly better to be safe than sorry, because it could be anything from nothing to something requiring immediate hospitalization. And it could be as serious as a brain bleed that's not going to result in symptoms until it's too late. If you get hit hard in the head, go to the damn hospital. Tummy pain that moves from the center then down to the right. Me ringing our national health line. Oh yeah? Nah, it's pretty sore, but I just want advice. Healthline. Nah mate, we're sending an ambo. Me, overkill. The next minute, I was in the hospital for several days with acute appendicitis. It got like 3 times bigger than it should have. Didn't cut it out though, because reasons, but I'm now convinced I'm immortal. If I hadn't rung them, I would have stayed home on my own, and to be honest, would have probably be dead AF. My stomach was bloated for 5 days. I saw my general practitioner. He did an ultrasound right then and saw fluid in my stomach, which usually indicates cirrhosis of the liver or advanced staged cancer. He told me to go to the ER, where I was diagnosed that night with advanced stage ovarian cancer. I was at a gym doing kangaroo hops and I fell face first. My legs never moved with the rest of my body. My husband, the trainers, and the owner of the gym all tried to tell me to relax and try again. I just looked at them saying, my legs aren't working. We all brushed it off as weird. It only lasted 30 seconds in random moments throughout the session, so maybe a total of 10 minutes off and on. 5 weeks go by, and at each workout session my legs stopped working for various activities. If I had gone to the hospital and gotten clear answers, I could have prevented a very serious onset of functional neurological disorder that left me suffering from seizures every day for 9 months, some days 30 plus a day. They are non-epileptic, but you aren't in control of your body. I was trapped inside, frozen in place, only able to blink for some days. I always wondered if I made the changes I needed to live with the disorder in those 5 weeks, would it have gotten so bad? I had to relearn how to walk, talk, and function without seizures taking over my body. It was rough. Being tired all of a sudden. Last year around the fall, we noticed my dad getting tired really easily, needing to sit down when going for a walk, sleeping in way later than usual, etc. He had gained some weight, so we told him he should lose it because it's obviously affecting him. Even our doctor told him he should really watch his health and eating habits if it's causing him discomfort. It got to a point where we got blood tests done to see if he's pre-diabetic or something. Then they noticed he's got really bad anemia and very, very high iron levels, which is unusual. They sent him to the ER for an emergency blood transfusion, where he met with a hematologist who immediately told him it looked like his bone marrow had basically stopped working. After a week in the ER, they diagnosed him with MDS, a form of blood cancer, and his only way of survival was a stem cell transplant. He got very lucky that they found a 100% matching donor fairly quickly, and he's seemingly recovering now. Always go to the doctor. 911 dispatcher. 2 things immediately came to mind. 1, UTIs in older women. They can cause a change in mental status that often gets looked over as dementia. 2, strong urge to poop, mostly men. It's pretty common that people are found dead on the toilet because they were having abdominal pain and thought they had to poop, but were having a heart attack instead. I'm not sure I can adequately describe this because the symptoms were so vague and I didn't want to go to the ER because I'd actually been there the week before for something else. But luckily I forced myself to go. So I was just not feeling right. I would have never gone to the ER for that. They would have laughed me out of the place. I kept telling my husband that I couldn't focus on the task long enough to finish it. A simple task like sending an email. I was just staring at stuff and not being able to follow through, which is not like me. I still didn't think much of it. I figured I was tired or something, and luckily for me, then I started getting an unusual pain in the region of my heart, which I'd never had before. Well, you don't mess around with heart stuff, so I went to the ER again. hyperkalemia, with just probably a few more days to live, they told me. It's basically a lack of potassium in your body, which I never even heard of, but turns out is important to absolutely everything in your entire body, lol. You need it to function, and it's a very small range of acceptable levels. It can cause you to pass out, and it can affect heart rhythms, which is probably what I was feeling. Although the doctor told me he didn't know why I was having heart pain, everyone else afterwards, from the pharmacist to my own doctor, said, well yeah, duh, it affects the heart. Anyway, I know this is vague, but that's what the symptoms felt like. I just felt not quite right and not like myself. The scary part is I never would have gone in if it wasn't for the heart pain. I have since seen YouTube videos of a woman who crashed into somebody's house while the person in the house was filming a live YouTube. The driver was so confused because she knew she hadn't had any alcohol or drugs. It was hyperkalemia. She passed out and drove into the house. Luckily, everybody was okay. In my case, I had just been put on a medication that leaches potassium, and although the doctor told me that and gave me potassium to take, it wasn't enough for my body. I was discussing this with another one of my doctors, and they mentioned that they had a patient who had something very similar due to not enough sodium. So these trace minerals that we take for granted turn out to be super important to the body. That woman ended up in the ICU. Also, if you've started any new medications fairly recently, make sure you note those are being and bring them to the ER with you. I know that me doing that helped get down to what my problem was in very quick fashion. Lucky for me, all they had to do was give me an IV potassium and I was fine. I shudder to think if I had waited a few more days. ETA, too much potassium is also a problem. Sudden high levels of pain in a single testicle. You have around an hour or two to save it. Lower back pain accompanied by urinary or fecal incontinence, usually with alternating numbness on your butt. It's a kind of nerve damage called cautionary, right side abdominal pain with vomiting. One of your legs or arms being colder than the other without reason. You may or may not have pain. If your pee is smelling like alcohol suddenly, it means your urine has ketones. Your feces smelling worse than usual and being shiny black. If you're being treated for iron deficiency, ignore this. Not being able to fart or defecate for an unusual amount of time, accompanied by stomach pain and sometimes vomiting. Sore calf muscles. I thought I overdid it at a workout, but light stretching, heat, massaging it, etc. all seemed to make no difference. It didn't really limit any movement, and it didn't hurt anymore after any specific motions. It was just sore. A month or so later, I started getting short of breath far too easily, even after just a short, easy walk, which I was far out of character for my usual fitness level. I'd had a nasty cold, didn't test for COVID, and thought maybe it was after effects. I didn't realize until later, after I finally passed out for 3 minutes after climbing a flight of stairs, then a hospital trip for x-rays, CT scans, and more, that these things were connected, the result of a blood clot that had probably started in my leg and eventually lodged itself somewhere in my chest, and so began my month in the hospital. We still don't know what caused the blood clot in the first place. Haven't had any recurrence since, 1 year later. Hopefully just a one-off fluke. Coughing, feeling like you have to cough when you breathe deep, could be a sign of spontaneous pneumothorax, lung collapse. I also had chest pain, but my anxiety causes chest pain, so I figured it was that. I felt so stupid for going to the hospital until they rushed me into the ER supply closet to do a chest tube procedure. It was during COVID, when a negative test result was required to move out of the ER. Cat bite. Even from your own cat that is fully vaccinated, and even if it isn't bleeding much, cats' mouths contain the Pasteurella multiseda bacteria, and bites have a high percentage, up to 80% of getting infected. The bite can inject this bacteria deep into your skin, and topical soaps and antibiotics cannot reach it. You need oral antibiotics just to be sure. Fatigue, but to an extreme. Walking 10 feet would use up all the energy I had. This went on for a month and got worse and worse. Other symptoms started showing up, but they were explainable. Night sweats? Well, it's king hot in our house. Got dizzy standing up? Well, I know I have blood pressure issue. Then my husband noticed I wasn't eating and got concerned. Eventually, I got a really sore throat, and a few months prior, I had strep. So I thought, okay, all these symptoms sound like I'm getting strep or I have an infection. After a week of the sore throat, I finally went to urgent care. I was immediately sent to an ER and didn't come out of the hospital for 43 days. Turns out, I had all the signs of leukemia. Sudden personality change. People think this is an obvious one, but sometimes it can be hard to spot. Maybe your partner has been liberal all their life, but suddenly they're voting Republican. Maybe they like chocolate, but now insist they hate it. Maybe they've always been aggressive, but now they're calm and collected. Could be a sign of some form of process in the frontal lobe, like a stroke or tumor. It could also be that they actually changed their mind or something. Many people only realize in retrospect after a diagnosis, oh yeah, they did suddenly change. For me, it wasn't a feeling that was difficult to pin down. It was a combination of feeling a bit woozy, like everything was moving slowly, and a bit like I was detached from my body. I could walk and talk and do things, but it was weird. So I sat down with a coworker who'd had a heart attack the year before and described my symptoms as best I could. He said, "Do you want me to take you up to urgent care?" I said yes. Urgent care took one look at me and said, "There are 2 emergency rooms nearby. Which would you like to go to? You need to go now." My blood pressure was somewhere around 240 over 150. I was feeling weird because I was on the edge of having a heart attack or a stroke. I was sent up to the ICU in short order, and according to one of the multiple doctors I saw over a long weekend, it was very close. Hypertension is no joke. We were on vacation. My youngest was 3. I started to notice he was turning his head normally, like his neck was stiff. No other symptoms, no fever. I might not have thought much of it, except for the fact our local news had just done a story on meningitis. So I immediately called the pediatrician for advice. And they said, take him to the ER now. ER didn't have a peds unit and couldn't rule out or confirm meningitis, so they rushed us to a children's hospital in the nearby city where they discovered he had retropharyngeal abscesses in the back of his neck. If left untreated, it would have grown and suffocated him. He needed immediate surgery and was back to being a sweet little self after a couple of days in the hospital. I was 25 weeks pregnant and noticed some watery discharge. I was confused. I might have been peeing myself a little. If you Google watery discharge while pregnant, Google tells you it's totally normal. I felt totally normal otherwise, with no cramping, blood, or anything else unusual. I called my OB after about 12 hours of this, just to check in after my husband felt concerned. I expected her to set up an appointment with me the next day, or to go to urgent care in the morning. But she said to go to the ER immediately. Once I arrived at the ER, I expected to wait for hours, but they admitted me immediately. Turns out my water had broken. I was expecting a huge gush like you see in the movies. I was having contractions 1 minute apart that I couldn't feel, and I was going into preterm labor, something called PPROM. At 25 weeks, I was still in my second trimester, hadn't planned a baby shower, and labor was something that felt a long way off. I hadn't even started prepping our nursery. I spent 46 days in the antepartum unit of the hospital on magnesium drips and trying to delay labor as much as possible, and ended up having my baby at 32 weeks. After my long hospital stay and some time spent in the NICU, he's a happy and healthy 1-year-old now. My mom was recovering from sepsis. She was in rehab for a couple of weeks on IV antibiotics and then was about to get discharged home. The day before she was supposed to leave, she had a nagging pain in her lower back that started in the day and got worse at night, but the nurses didn't take it too seriously and gave her Tylenol, and the doctor figured it was just a pulled muscle from PT. I talked to her that afternoon at 4 p.m. She was fine. At 5 p.m., the rehab facility calls to tell her she was having trouble breathing and went to the ER. Get to the ER at 6 p.m. She's intubated. Out of precaution to take her for a CT to confirm the hypothesis that this is a pulmonary embolism. Next thing I know, they've been doing CPR or chest compressions for a half an hour and then tell me there's nothing they can do. Dead by 8 p.m. Not to say a nagging pain in the lower back is cause for concern, but depending on the circumstances, it's something to look out for. A hard stomach, not just stiff, but pressing down and your stomach tries to guard against the pressure and doesn't budge much. It can come with severe pain or it can come with no pain. It could be a major medical issue though, because of ischemic gut or, in layman's terms, dead gut. It is exactly what it sounds like. Blood flow cuts off to your bowels and they are now rotting inside you. I'm trying to become a doctor and I'm really interested in medical stuff just as a topic of interest. So I've listened to and read quite a few medical books and listened to care provider podcasts. One of the podcasts did an episode on dead gut, and that is the thing that scares me the most. People can come into the ER with almost no pain whatsoever because their nerves are rotting and your abdomen isn't set up for lots of pain receptors. So they sit in the waiting room for hours with the most serious medical emergency in that ER room and literally rot. It has a 30% mortality rate in the first 12 hours and a 70% after the first 12 hours of onset. Some people go until their guts are incompatible with life before they realize. It can be as minor as your body throwing a clot in a weird spot and blocking blood flow to your guts. Funny you should ask, as I'm in the ER right now. Bruises. I have several bruises that I tried hard to explain away. My wife is a PA and also noticed red clots in some area on my skin. She said either alone is nothing, but both. Turns out my platelets are critically low, 8K. I'm 54 and live a normal, healthy life. The reason is unknown, but basically my blood will not coagulate if there is a wound, and this low can spontaneously bleed. Hitting your head. I'm not talking about the obvious I got hit with a hard object and my head is bleeding profusely situation that everybody knows they need to get medical attention for. I'm talking about the seemingly harmless I banged my head but there's no blood so everything seems fine situation. I had 2 coworkers who hit their heads and then complained of migraines days afterwards. Each time I told them, you really need to get that checked out. Each time I was ignored with excuses like, my head isn't bleeding, I just banged it. One passed out on the sidewalk while walking to work the next morning. When the ambulance took him to the hospital, they found out he was bleeding internally, and he had to be rushed to another hospital to get the blood drained from his skull. The other was a no-call, no-show at work the next day. They went to do a wellness check on him, found him dead in his bed. Had a blister on my ankle that went septic as a kid. It had scabbed over. I was a stupid kid and ripped the scab off, opening the wound again without cleaning it or telling an adult. It wasn't until I was walking home from school one day that my whole leg had swollen up and a red line was riding up my thigh, and I had a pretty bad fever. I walked in the door, fell over, and my mom rushed me to urgent care, where I got put on an IV antibiotic. LOL. I was told that if I'd even been an hour later, I would have been in very, very serious trouble. The grossest part was I was wearing tights to school, and a new oozy gummy scab had formed with the tights right within it. When I got to urgent care, they had to basically rip it back off with the tights, and I thought I was going to pass out from the pain.